Hi, I'm Nick Brown, pain specialist physiotherapist, and welcome to my YouTube channel. Today we're going to be talking about fibromyalgia in our Focus on Fibro series. I see a lot of people with fibromyalgia, so in this first session we're going to be covering what the symptoms of fibromyalgia are and how it develops to help us to better understand this diagnosis. It's not a condition a lot of people know of, and it can be very misunderstood. Remember, this video is for general information only and is not intended to be used as individual medical advice. So fibromyalgia is a long-term condition, so there is no known cure, and there are a range of symptoms associated with it. These can vary widely from person to person, and no two people that I see are ever the same. The common symptoms, however, include widespread pain. So that's pain in multiple places around the body, usually both sides of the body and both above and below the waist. Fatigue, and that's even after sleeping for long periods. People with fibro just wake up feeling unrefreshed. Sleep can also be disrupted by pain itself, but there is also a problem with the quality of the sleep. You can also have other sleep disorders like restless legs or sleep apnea. There are always cognitive difficulties. So the classic fibro fog you may have heard of, and that impairs the ability to focus, to remember things, pay attention and to concentrate, and can also be a really worrying symptom for a lot of people. There are then other symptoms like headaches, symptoms of IBS, irritable bowel, depression, hypersensitivities to light, sound, touch, and altered heat regulation are also common. A range of factors can make these symptoms worse, such as stress, illness, overdoing it, poor sleep, and sometimes there is no obvious cause. The symptoms are commonly unpredictable and they don't always follow a clear pattern. Diagnosing fibro can be challenging because there are no specific diagnostic tests for it, but there are guidelines to aid this process. You will have a detailed medical history taken, a physical exam, and your doctor will usually perform blood tests to rule out other conditions that can appear similar. There is an overlap of symptoms with things like side effects from medication, even the menopause, inflammatory conditions like arthritis. And you can, however, have fibromyalgia alongside all of these conditions and many others. So it isn't a mutually exclusive diagnosis and it can coexist. The pain and symptoms described must persist for more than 3 months for a diagnosis of fibromyalgia to be considered. And although it predominantly affects women, aged 40 to 60, men and people of all ages could also develop fibromyalgia. So the exact cause of fibromyalgia is not known, but it is believed to be due to a combination of genetic, environmental, hormonal and neural factors. So let's break these down. Fibromyalgia tends to run in families, not always, but there is thought to be a genetic component to it. So if someone in your family has fibro, it doesn't definitely mean that you'll get it, but there can be a susceptibility, and then usually one or other of the other factors can be the actual trigger. So hormonal fluctuation, particularly during the menopause, can influence the onset or severity of fibro. And there are also lots of overlap between the symptoms of fibro and menopause when trying to work out the correct diagnosis. So neural factors, the nervous system, changes within the central nervous system, that's the brain and spinal cords, play a critical role. So we believe that fibromyalgia involves an abnormal response to nerve messages from the body, and they're being interpreted through normal sensations like touch, movement and pressure as a painful experience. And there are several neurotransmitters like serotonin, adrenaline, dopamine, which are implicated in this altered pain perception. And that results in an increase in the excitability and sensitivity within the nervous system. Recent studies have also reported something called small fibre neuropathy in a number of people with fibro, but not all, which is also important. And that's a problem with the small nerve fibres, which detect sensations in the skin, like heat, cold, pressure, and that can manifest as pins and needles, tingling, pain, numbness. And it also impacts on automatic functions of the body, like digestion, sweating, heart rate, bladder control. So that may be associated with a range of symptoms also. A significant proportion of people with fibromyalgia have experienced significant stresses and trauma in their lives. And that may be during childhood or later in life. It may be one significant event or a series of things that have happened to them over time. And these can be psychological, physical trauma, and often a combination of both. and these appear to play a significant role in the development of fibromyalgia. There's also evidence of increased levels of pro-inflammatory markers in fibromyalgia, suggesting some kind of immune system activation and response might also be contributing to the condition. A lot of people I see also have the trigger being some kind of illness or infection, so that's significant as well. So you can see there is no one thing that is the cause of the condition, and the onset of fibro is often described as the perfect storm, where a range of factors come together to bring about this condition. Diagnosis has evolved from a reliance on tender points to a more comprehensive assessment, emphasising the widespread nature of pain and associated symptoms. The impact of fibromyalgia on someone's life can be profound, so do reach out to your doctor if you think you may have it, and also to your trusted healthcare professional for supporting learning more about and managing the condition. Thank you for listening today. Remember to subscribe to the page to keep up to date with the latest releases, or share with someone that you think needs to hear this today. Bye for now.